You are listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back. This is Adam Rosen, and you're listening to the Your Knee, Your Health podcast. In today's episode, I want to talk to you about hip arthritis, and more importantly, how hip arthritis can manifest itself as knee pain. So there are a number of times where patients will get referred to me for knee pain, and they may or may not come with x-rays, and they'll describe pain in a typical location. They'll kind of grab the inside of their knee and say that it gets worse when they stand and walk and do activities. All of these things which would point you to believe that they have knee pain or knee arthritis. And you do x-rays, and the x-rays look perfect. What's a little bit more confusing sometimes is if you have x-rays that show arthritis, which is mild, and it's worse on the inside, it would sort of make sense that if they're grabbing that part of their knee and they're having pain there, that you may be fooled into believing that it's actually their knee that causes problems. So what I want you to think about, though, is the sciatic nerve and sciatica. A lot of people understand that the sciatic nerve is deep in their butt, but a lot of people understand also when they get sciatica pain, that pain can go all the way down the back of their leg into their foot. And in a similar way, there's a nerve that crosses over the front of the hip joint, and that will sometimes cause pain that will go down the front or inner part of your thigh into the inside of your knee. And they may never really think of this as hip pain. Most commonly we'll see people with hip arthritis that have pain in their groin. So, I always tell people that, if you're over 50 and you don't play soccer, don't believe that you pulled your groin. More often than not, you actually have hip arthritis. Some people will have pain and they'll point to the side of their hip. Some people will describe it deep in the buttock, but usually these people come to the doctor with complaints of hip pain or pain around the region of the hip, and you'll get a hip x-ray. But it is not uncommon to show up to your doctor with knee pain, and this goes down this kind of realm of, okay, you have knee pain, let's get some x-rays. Oh, you have a little bit of arthritis. Take a pill, do some therapy, maybe have an injection. Worst case scenario is have a surgery like a knee replacement and now find out that the pain is still there. The clue there should be if you get an injection and the injection doesn't help at all, you got to really look for other causes. It is possible that the injection just may not help. But if you've had no relief, we got to look at other causes. So we always teach young students, young doctors early on, you always examine the joint above and below. So if someone has an injury and a trauma, they fall on their elbow, you still have to evaluate their wrist and their shoulder. And if someone has a shoulder problem, you got to evaluate their neck and their elbow. So if somebody has a knee problem, we always evaluate the ankle and the hip. And what you'll find is you go to turn the patient's hip in and out. And number one, it probably won't move if they have hip arthritis. And two, it'll hurt. And sometimes they'll actually put their hand in their groin, but occasionally they can put their hand down to their knee. So one of the things that you can do at home, very simply, I'll talk to patients and say, can you cross your legs? Can you tie your shoes and socks and put your ankle up on top of your opposite knee? And when they can't, or when they go to turn and twist it and they realize they have pain, that's a pretty clear indication that there's a problem going on with the hip. The other thing which may happen with hip arthritis, if you develop arthritis and bone spurs, is the hip will actually start to turn itself out. And because the hip is deep and you don't really have these landmarks around your hip itself, people will recognize that it is my foot or my knee is turning out. And it's not really your knee or your foot or ankle that's turning out. It's actually your hip socket. Now, our knee is designed mostly to bend forward backward. So as your hip turns out to the side and you try to walk forward, your knee is actually trying to bend side to side. So it's another reason why people may also have knee pain, even though the problem is in the hip. So you want to take a look that if you're having knee pain, maybe you saw someone and they said, your knee x-rays don't look that bad, but they weren't able to come up with a real answer as to why you're having the pain or where the pain is coming from. Really take a look at your legs. Take a look at your gait. When you stand, does that foot and knee turn out? If so, it's probably your hip. If you can't rotate your hip in and out, if you have difficulty, crossing your legs to tie your shoes and socks, it's probably your hip, even if your pain that you feel is in your knee. So if there's any question, a lot of doctors will get x-rays of both your hip and your knee, and lo and behold, then you have hip arthritis. And at least it explains where the pain's coming from. And, most commonly, if I have those patients that go down the realm of, okay, we did therapy, pills, maybe shots, and now I have a hip replacement, it's kind of a funny but an interesting question. You get done a hip replacement and you ask the patient, how's your knee feel? And miraculously, their knee pain's gone. The hip pain's improved, their hip range of motion's improved, their function, their gait's improved. But the thing that was bothering the most, that inner knee pain or that inner thigh pain, has resolved. So just a couple little tips and tricks on understanding how hip pain may manifest itself as knee pain. And it may help you and maybe your other friends that may be struggling or dealing with similar issues. So thanks again for listening. I'm Adam Rosen. This has been the Your Knee, Your Health podcast. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.